Okay. Our next speaker, he's a senior fellow at an institution that we love and has done some amazing work. He directs the Institute's research on healthcare, social welfare policy, and Social Security. As a matter of fact, when a number of people heard he's coming, they said, I hope he's going to talk about Social Security, because he is the expert in the world on it. He's written numerous books on public policy, appears regularly on network and cable news programs. The New York Times calls him, and I quote, a lucid writer and skilled polemicist. Tonight he's going to tell us what the real problems will be with Obamacare, which makes the website problems look extremely good by comparison. Michael Tanner, Cato.
Well, thank you very much. Appreciate it. And I want you all to know, if you like your Social Security, you can keep it. Actually, I had a terrific PowerPoint presentation I brought down with me that I was going to show you tonight with all sorts of stuff that faded in and out and audio-visual stuff all fixed in there. It was put together by the same people who put together the Obama website. So, well, at any rate. Actually, we've had a lot of fun tonight making fun of the Obamacare website. And I have to tell you, you know you're in trouble when the fact that the Obamacare website being a national joke is probably the best thing that's happened to Obamacare in the last couple of months. Because let's look at what the real problem is. I mean, someday they're going to fix the website. Someday. It's right now they're almost up to private sector standards, they said. So we hope that eventually it'll get running. But the real problems with Obamacare are not so easy to fix. As of last week, 5.4 million Americans had lost their current health insurance. And that number before January 1st is expected to reach roughly 10 million. That's going to be the 10 out of the 14 million Americans who have individual health policies are going to lose those policies. And I know the president says, well, that's only a small portion, about 5% of the market, 10 million Americans, who cares about that? And he did, say these are subpar policies, or as his spokesman actually put it more colorfully, he said these are crappy policies that people have. Well, they're not quite so crappy, it turns out. The number one reason why policies were not compliant with Obamacare, and therefore you had to lose them, was they lacked pediatric vision and dental care, which, if you're a 65-year-old gay man, I'm sure is a very big concern to you. It doesn't quite, I mean, there may be actuarial reason for pulling these things, but, that's not the number one reason. Number two reason, didn't have proper drug and alcohol rehabilitation therapy in these plans. I'm sure you could have an insurance plan that's not subpar that misses some of these things. And as for just being the 5 million people, well, that's this year, because the individual mandate, which is what's driving this, goes into effect January 1st. The president, of course, postponed the employer mandate until January 1st, 2015. But when the employer mandate takes effect, the same rules for compliance and having an Obamacare compliant policy affect your employer plans as now affect the individual plans. And if you have a policy that your boss gives you that you get through your place of employment, and it doesn't meet all the standards that the Affordable Care Act says it should meet, which is a huge number of standards, including mental health benefits and drug and alcohol rehabilitation therapy and prescription drug coverage, which is why the prescription drug industry spent $150 million advertising in favor of this law back during the debate, and pediatric care and maternity care and dental and vision care for children and coverage for contraceptives, the standard Fluke mandate. If it doesn't have all of these sorts of things, you're going to lose that policy as well. And in fact, the Department of Health and Human Services and the Congressional Budget Office and CMS all have different estimates for how many people are going to lose their policies, but somewhere around 70 to 80 million Americans will lose their employer-provided policy as well. So if you think we're getting hit now, come this time next year, you're going to see those policies begin to hit. And it's just coincidence, I'm sure, that the Obama administration pushed back next year's deadline, open enrollment period to just after the midterm elections rather than just before the midterm elections. So they've actually shifted that back. But you're still going to, next November and December, going to be hit with those cancellations. Second is, of course, the question of with not just losing your insurance policy, but losing your physician. Because when you have to change plans, there's the question of whether your current doctor is going to be in those new plans. And as we've already seen, the insurance companies, in order to keep, because we're driving new costs to them, we're requiring them to cover additional benefits, so their costs are going up. But we're requiring them to participate in these exchanges where we're forcing down the cost. In order to comply, being caught between the two, they're cutting back on the networks, the size of the networks, and which doctors and hospitals are included in those networks. And many of the top providers in this country are no longer included. About 40% of physicians are being excluded from all networks that are being offered on the exchanges. And some of the top hospitals, Sloan Kettering Hospital in New York is not included in any plan that's offered in New York State. That's the top cancer hospital in the country. If you're in California, Cedars-Sinai Medical Center is not included in any plan in the state. In Tennessee, Vanderbilt University Hospital, not included in any plan in the state, and so on. Now, of course, you can go out of network, but in that case, you're going to have to pay considerably more, and in many cases, full price. In New York State, not a single plan covers any out-of-network costs. So if you wanted to go to Sloan Kettering, you'd have to pay 100% of the cost for going there. So you may not be able to keep your physician, assuming your physician, of course, stays in practice, or your hospital stays in practice. They estimate that about 15% of all hospitals will close as a result of the health care law, rural and inner-city hospitals being the hardest hit. So you may not be able to find your hospital as well on this. And then, of course, there's the impact on the economy. We already know that we're moving to a part-time nation in large part because of the health care law and other things involved as well. But the fact is that about 88% of all new jobs created since the Obama administration came into office are part-time jobs. And we're finding companies increasingly cutting back the number of hours in order to get people down under the 30-hour threshold so that they're not required to participate in this. Because this is a little common sense. The fact is that health care is expensive. And if you're going to require a company to add to the cost of hiring workers by paying $7,000 to $10,000 in additional expenses for that worker over and above their wages and other benefits you're providing for them, well, they're going to hire fewer workers. And so we're going to see slower economic growth as a result of this as well. And, of course, we're going to see higher taxes, $1.2 trillion in new taxes over the next 10 years to help finance this, in addition to about $1.5 trillion in additional debt in order to finance this. And finally, it brings the whole question of whether or not all of this is going to work. Because the fundamental part of Obamacare, the fundamental, if you want the original sin, you can forget about all the mandates and all the taxes and all the bad stuff that goes with it. The fundamental premise of Obamacare is that young and healthy people will overpay for health insurance in order to subsidize older and sicker people within the program. They're counting on young people to be really, really stupid. And it turns out they're not. They need at least 38% of all the people who enroll in Obamacare to be under the age of 30 and in good health. So far, roughly 22 to 24% of the people in Obamacare who have enrolled are under 30 and in good health. They're not even close to getting to those numbers. If they can't, then the whole system comes crashing down. Thank you.
Let's take a question or two. Question.
More time flies.
It went fast. All the way in the back. Wow. Can you get back there? Wait a second. Let's get a mic so people who are listening to this around the country, and actually in England, a couple of organizations are carrying on their website.
Thank you. Shouldn't we be just as angry with the insurance industry for letting Obama lie all these years? They've been working on these new higher mandate policies, so I think they're as complicit as the president is.
Oh, yeah. The insurance industry and the Obama administration played this wonderful game where they beat up on each other in public, and then private have negotiated all this behind the scenes. This was a huge boon for the insurance industry. They were more than happy to accept a few extra regulations in exchange for 50 to 70 million new customers that they thought they were going to get with taxpayer subsidies to buy their product. They thought they were getting a deal in which everyone was going to be required to buy their product and the government would pay for it. I mean, just think of your industry. You know, you have a car dealership and the government says everyone's got to buy a new car tomorrow, and the government will pay for 50% of the cost of that car. You know, the automobile industry would love it. Matter of fact, didn't we have that? It was called Cash for Clunkers.
Website.
Cato.org. That's it. Thank you.